So now I'd like to introduce Sharon Wallace, who's been working very closely with us on this morning's presentation. Sharon is a Queensland woman who came to the Northern Territory many years ago as an Aboriginal health practitioner and has been an absolute leader in this field and in working to increase the understanding amongst the general population and particularly amongst primary healthcare practitioners of the role of Aboriginal health practitioners. So this morning she's going to talk to us about working effectively in Aboriginal primary healthcare and particularly in the primary healthcare teams in which we work. So thank you, Sharon.
Hi everyone. So I'm here today to talk about working effectively and the roles and relationships within the health service setting, especially the community controlled setting. So I'll just start off with a little bit about who I am. So as you can see, there's a few pictures up there. I come from a family of 6 children. So you can see down the bottom there, that's me with my first child. I had her when I was 18. I'm the eldest of 6. That's my parents there. We always grew up with foster children. Mum and Dad always fostered children in our family. That picture over on the bottom right there, I don't have a little pointer thing, is my daughter now. She's 20 years old. And that's my little fella. He's 3, going on 33. You can see up the top here, that's my mum and dad and all of my nieces and nephews who I look after often. That fella there with no shirt on is my brother. Was my brother, I should say. He still is, but he's no longer with me. In 2010, he was an Aboriginal death in custody in Darwin prison. That's some of his children that are up the top here. So when as the eldest child in my family, I had a lot of responsibility. Mum and Dad grew up, they got married in Dalby in Queensland when I was 4 and moved to Melbourne, and my dad drove trucks. And I grew up in Melbourne till I was 15. Then we moved back up to Queensland to be closer to Mum's family. My mum's from Charleville, so she's a Wankamara woman, and my dad's a Kamilaroi man from New South Wales in Gunnedah. Once we moved to Queensland, I was able to make connections with Mum's side of the family. I had my daughter at 18. That wasn't a good, healthy relationship, so we separated. Well, I got rid of him basically when she was 1 year old, and I enrolled and I got a traineeship to become an Aboriginal health worker in 1995. So it's been 18 years now I've been an Aboriginal health worker. I worked in Toowoomba and moved from Toowoomba to Katherine in 99 and worked at Worley there, Worley-Wellanjang. And then went on to be an educator, health worker educator, and then moved to Nhulunbuy. Lived there for 7 years and worked also as a lecturer, training Aboriginal health workers. And then my brother passed away and his children got put into care. They got removed from the mother who lost the plot a bit. So then I moved over to get my kids out of care, and that took 12 months to do that. And to help them with the loss of their father, and then after getting the kids out of care, I was lucky enough to get a job with AMSANT. During that time, actually, it wasn't long after I moved over here from Nhulunbuy. Got a job as a project officer, and now I work under the Indigenous Chronic Disease Package. Supporting the tobacco and healthy lifestyle teams that you may come across in your travels. You hear a lot of, there was recent comments from Scullion about that workforce. Lots of money's been spent on tobacco control and healthy lifestyle, and as you know, chronic conditions are our biggest contributor, I guess, to our high mortality rates. Last year, Aboriginal health worker registration went national, so I'm also on the accreditation committee under APRA, which is a privilege. And finally, I guess up the top there you can see that's my little boy sitting on the front of a trolley at an airport somewhere in Australia. I can't remember which one. But apart from all of my family responsibilities, I love my job, my career. I'm very focused. I love being an Aboriginal health worker and working in primary health care. And I guess Erin and I are here. AMSANT's very supportive of growing us, in our leadership roles, but that does mean that we have to travel. And so I'm very passionate about, and that's what I love about working for Community Control, is they're very supportive of us balancing our work and our life and our family. So I often take him with me, and so that's him on one of my travels. It was good before he turned 2 because I could take him with me and book him into childcare and go to work, and it was really good. Now I've got to pay for his seat, which is a bit of a pain, but it's good because I get to balance that family and working life. I'm also halfway through my Masters of Public Health, just finishing up on my epi and biostats, which I'm glad I got through because I'll never ever want to do it again. But so life is pretty full on. I'm really happy to be able to come and talk to you today. Normally, this isn't the sort of introduction that you would normally get, and I'm doing it for a reason, just so you know. So yeah, I guess that's me, that's my family. Oh, I mentioned that my brother has passed away. That coronial inquest, out of that, we're now happy to be able, one of the things I really pushed through losing my brother and the coronial inquest, Greg Kavanagh was very supportive, and now we have Aboriginal health workers in the prisons. As of the 1st of July, the prisons are going to go smoke-free in the Northern Territory, the first place in Australia to have the prisons absolutely smoke-free. That wasn't because my brother passed away, that was just my other job that I'm involved in, and it was actually come from the prison and the new prison's being built, but I'm involved in that. In July last year, my mother passed away from adenocarcinoma, which was a very sad time for us. So now my dad lives with me, and there's a couple of teenage girls up there at the end that are 13 and 14, which my mum and dad raised, so they live with me. So I raise them now. Their father is my brother. He lives with me when he's not in Nullarbor. He's on 2 weeks on, 1 week off. So he supports financially. And we've got a friend of my husband's who's going through a separation. So he was supposed to be sleeping in a tent on the veranda, but now he's on the lounge. So, so it's a full house, and that's how this is how our family is. This is how, you can't say no, and we don't get to come to work and go home and light the candles and have a bubble bath, and I wish, that's why I like travelling away sometimes.